Dr. Deuk. It is December 18th, 2020, and if you watched our surgery yesterday, you saw this gentleman have a Deuk laser disc repair, L34, L45, L5S1 left approach, and he was our last surgery of the year 2020, which has been a tough year for everybody, including us. And so he's here today, one day after surgery. He went home about an hour after his surgery, and he's back here for a checkup. How are you feeling?
I'm feeling awesome. 100% better.
Yeah?
No pain down the leg, no pain in the back, other than surgical.
Would you say that the Deuk laser disc repair cured your back pain?
Yes.
And your leg pain?
Without a doubt.
Excellent. And you were very happy when you saw me this morning. What did you say?
I wish I'd seen you sooner.
Yeah, a lot of people put it off because they don't know about it or they don't believe it works, surgery, but it does work as long as you get the right diagnosis. And that was an interesting thing with you, right? Because we knew from where you showed me your pain was on your back, and we looked at your MRI, we saw herniations at L45, L5S1, which correlated with the localization of your typical back pain. But there was a question about L34, and we said, well, we'll test it in the operating room. If it's painful, we'll fix it. And we did test it, and it was a 9 out of 10 pain.
Yes. With
the discogram. And so there was a tear, an annular tear in the back of the disc, and I repaired it with the laser, and here you are, pain-free. How long have you had back pain for?
20 plus years.
So,
one injury was from childhood. So,
So here's a patient who's had back pain for 20 plus years, and in 1 hour with the right surgery, the Deuk laser disc repair developed here at Deuk Spine Institute, endoscopic with an incision this big, 7 millimeters, outpatient with a few drops of blood. Here you are, pain-free for the first time in 20 years.
I woke up this morning, I said, so this is what it feels like to be without pain and sleep without pain. Like normal people. Mm-hmm. It was first in a long time.
Was it worth it?
Very much so.
Yeah.
Wouldn't hesitate to do it again. Don't want to do it again.
You won't have to.
I will be good and follow all procedures and hopefully only see you for visits.
And this is why we do what we do at Deuk Spine, because no one else can fix patients like this with chronic back pain without using our techniques. So we want more people to know they don't have to live for 20 years with back pain. And how did that pain affect your life for the last 20 years? Did it change the way you lived? Was it a good change or a bad change?
It was a bad change, and as getting older it got worse because we don't heal as quick and we get hurt quicker. And my quality of life went down from the number of things I could enjoy and do to almost nothing. Excited to be back. My son's excited that maybe come summer I can bowl with him. My daughter, I can play tennis with her, and go for walks with the family now.
Good. Well, there you have it. Everyone has their own story about how their back pain affects their quality of life, but you notice that he mentioned family members, children, his wife. Fact is that when you live in chronic pain, it affects everyone around you. And if you love and care for someone and they have chronic pain every day, you worry about them constantly and you suffer with them.
And they suffer with you.
Yeah, right? That's what I mean. And it's so the chronic pain doesn't just affect you, it affects the people that care about you, which is your family and friends. And we're just happy that we're able to cure it for you at Deuk Spine.
Well, thank you. And I can't thank you enough.
Happy New Year.
Happy New Year.
All right. Enjoy.